Hi friends, good evening and welcome to my channel Mookambika Nursing. Friends, in this video we can see a set of questions from medical surgical nursing. Yesterday we discussed 10 questions from medical surgical nursing and this video is the continuation of yesterday's video. Here we can see next 10 questions. We will see the question one by one. The first question: Dash is a clinical syndrome usually characterized by episode or paroxysm of pain or pressure in the anterior chest. And the options are option A angina pectoris, option B sudden cardiac death, option C supraventricular tachycardia, and option D none of this. Here the question is Dash is a clinical syndrome usually characterized by episode or paroxysm of pain or pressure in the anterior chest. Okay, and the correct answer is option A angina pectoris. This is the actual definition of angina pectoris. Angina pectoris is a clinical syndrome usually characterized by episode or paroxysm of pain or pressure in the anterior chest. There is a pain and pressure in the anterior chest, usually characterized by an episode, slowly characterized by pain and pressure in the anterior chest, and the cause is insufficient coronary blood flow resulting in decreased oxygen supply. Okay, so our question answer is option A, angina pectoris is the correct answer. Second question: which of the following are the types of angina? And the options are option A stable angina, option B unstable angina, option C refractory angina, option D variant angina, and option E all of this. Here the question is which of the following are the types of angina? Here correct answer is option E all of this. Here all of these are the types of angina. We will see the types of angina in details. First one is stable angina. Stable angina means predictable and consistent pain that occurs on exertion and is relieved by rest or taking nitroglycerin. So each and everything is there. Unstable angina is also known as pre-infraction angina or crescendo angina, and intractable or refractory angina. Then variant angina is also known as Prinzmetal angina and silent angina. These are all the types of angina. Here our question is what are the types of which of the following are the types of angina? So stable angina, unstable angina, refractory angina and variant angina all are the type of angina. Option is the correct answer. Third question is predictable and consistent pain that occurs on exertion and is relieved by rest is called. Options are option A stable angina, option B unstable angina, option C refractory angina, option D variant angina. Here our question is there is predictable and consistent pain that occurs on doing physical activity or due to mental stress and it is relieved by taking rest is called stable angina. As we already saw in the types of angina, first is stable angina. Stable angina means there is a predictable and consistent pain. Okay, it is a consistent pain that occurs on exertion. Exertion means while doing activity or in mental stress, and it is relieved by taking rest or taking nitroglycerin. It is called stable angina. Okay, here our question answer option A stable angina. Fourth question, another name for unstable angina is. Options are option A pre-infraction angina, option B crescendo angina, option C silent angina, and option D both A and B. Okay, here question is the other name of unstable angina. Unstable angina is also known as pre-infraction angina or crescendo angina. So here answer is A and B. Okay, unstable angina, the other name of unstable angina is pre-infraction angina or crescendo angina. In this type of angina, the symptoms increases in frequency and severity. Okay, the chest pain or the pain will be increases in frequency and severity and may not be relieved by taking rest or nitroglycerin. But in stable angina, if the patient is taking rest or taking nitroglycerin, the symptoms may be relieved. Here in unstable angina, it is not relieved by taking nitroglycerin or rest. Here our correct answer is option A and B. We'll see next. Fifth question, which are the route of administration of nitroglycerin? And the options are option A sublingual tablet or spray, option B oral capsule, option C intravenous administration, and option D all of this. Here question is, which are the route of administration of nitroglycerin? The route of administration of nitroglycerin, here correct answer is all of this. Okay, D option D is the correct answer. So nitroglycerin can administered by sublingual tablet or spray, oral capsule, topical agent, and intravenous administration. Okay, sublingual tablet or spray, oral capsule, topical agent, intravenous administration or spray. Usually sublingual nitroglycerin placed under the tongue or in the cheek. Okay, cheek or buccal pouch. It is alleviate the pain of ischemia within 3 minutes. Okay, sublingual nitroglycerin is placed under the tongue or buccal mucosa, so it alleviates the pain within 3 minutes. Okay, here our question answer is, the route of administration of nitroglycerin is option D, all of these. Sixth question, why patient is instructed to renew the nitroglycerin supply every 6 months? And the options are option A, it is volatile, option B, it is inactivated by heat, moisture, air, light and time, and option C, both A and B, option D, none of this. Here our question is, why we are instructing the patient to renew their nitroglycerin supply every 6 months? That is the question. So answer is both A and B is the answer. Here this is one of the self-administration technique for the patient. So we have to advise the patient that nitroglycerin is volatile. Volatile means it is easily evaporated by atmospheric temperature and it is inactivated by heat, moisture, light, air and time. Okay, so it is inactivated by heat, moisture, air, light and time. So we have to instruct them to renew their nitroglycerin supply every 6 months. Okay, so this is one of the self administration of technique of nitroglycerin, those who are taking by self. Okay, here our question answer is both A and B. It is volatile and is inactivated by heat, moisture, light, air and time. Option C is the correct answer. Seventh question, an example of 4 beta blockers. And the options are option A nitroglycerin, option B metoprolol, option C atenolol, and option D B and C. Here the question is, which is the example of beta blockers? Here the correct answer is option D, B and C is the correct answer. That is metoprolol and atenolol are the beta blockers. This beta blockers reduces the incidence of recurrent angina, infraction and cardiac mortality. So this beta blockers reduces the recurrent angina. Angina means chest pain and myocardial infraction, and also it reduces the incidence of cardiac mortality. So thereby it reduces myocardial oxygen consumption by blocking beta adrenergic sympathetic stimulation to the heart. So heart rate is reduced. Reduced means it can come to normal, and BP also is reduced, and myocardial contractility also reduced. Okay, reduced means it can be in normal, it can come to normal level and helps to balance myocardial oxygen need and supply. So this is the main important use of this beta blockers. So here our question answer is option D, Metoprolol and atenolol are beta blockers. Eighth question. An infant with congestive heart failure is receiving diuretic therapy and a nurse is closely monitoring the intake and output. The nurse uses which most appropriate method to assess the urine output? And options are option A, bathe the diapers, option B, inserting a Foley's catheter, option C, comparing intake with output, option D, measuring the amount of water added to the formula. Here the question is infant with congestive heart failure is receiving diuretic therapy and the nurse is monitoring the intake and output of the infant. Question is which is the most appropriate method to assess the urine output of the infant? That is the question, and the correct answer will come among this option. Option A is the correct answer, weigh the diapers. That is the correct answer for this question. So in congestive heart failure means is the inability of the heart to pump a sufficient amount of oxygen to meet the metabolic need of the body. That is called congestive heart failure. And the most appropriate method for assessing the urine output in an infant receiving diuretic therapy is to weigh the diapers. This is the most appropriate method. Here the option comparing intake and output would not be provide accurate method. Okay, and also measuring the amount of measuring the amount of water added to the formula is an unrelated to the urine output. Okay, and inserting a Foley's catheter, this is an accurate method, but this we can't do it for infant and children. So here among this option, weigh the diapers is the correct answer and accurate for infant. Option 9. The question. A client with a history of cardiac disease is due for a morning dose of furosemide. Laxis. Which serum potassium level, if noted in the client's laboratory report, should be reported before administering the dose of furosemide? This is the question, and option A 3.2 milli equivalent per liter, option B 3.8 milli equivalent per liter, option C 4.2 milli equivalent per liter, option D 4.8 milli equivalent per liter. Here our question is a client with cardiac disease and is taking furosemide. Before administering furosemide, which among the lab value of serum potassium level is reported to the physician by the nurse and why she is reporting? That is the question. Here correct answer is option A 3.2 milli equivalent per liter. That is the correct answer. Okay, 3.2 milli equivalent per liter is the correct answer. The normal serum potassium level in the adult is 3.5 to 5.1 milli equivalent per liter. That is the normal serum potassium level. Administering furosemide or Laxis to a client with low potassium level. Low potassium level means 3.2 is the low potassium level among our option. Okay, low potassium level and patient is already having cardiac problem. This could precipitate ventricular dysarrhythmia. So, the nurse should report this to the physician before administering furosemide. Option A 3.2 milli equivalent per liter is the correct answer for this question. 10th question. Why patient is advised to sit down for few minutes when taking nitroglycerin? And the options are option A to avoid hypertension, option B to avoid hypotension and syncope, option C to reduce fatigue, option D to prevent bleeding. Here the question is why we are advising the patient to sit down for few minutes while taking nitroglycerin. That is the question, and the correct answer is option B is the correct answer, to avoid hypotension and syncope. Here, this is also one of the home care or self-administration advice to the patient, those who are taking nitroglycerin. We have to advise the patient to sit down for a few minutes when taking nitroglycerin to avoid hypotension and syncope. So, in our question, option B to avoid hypotension and syncope is the correct answer, option B.